welcome back.
What's up, everybody? Welcome back to another episode of the Juice Toya podcast, brought to you by One Body LA. I'm your co-host, Juice.
And my name is Toya. Welcome back to another episode 16.
Wow. If you've been listening to us, we appreciate you for hanging out with us for 16 total episodes. So appreciate
We've been more consistent. We have a lot of plans for the podcast coming up. So we appreciate your support and following along with us on this new adventure that we're embarking on.
Oh, yeah. So we got so much to talk about today, as you've seen from the title. We're talking about knees today. I've struggled with a lot of knee issues over the course of my career, so we figured this would be a great topic to talk about. It's one of the most, it's one of the most commonly asked questions as far as like limitations when it comes to our YouTube channel, our clients and stuff. So we figured this would be a great episode to give you some insight on how to take care of your knees, honestly, and how to fix them in a way if you struggle with knee pain or instabilities and stuff like that. So
absolutely.
Before we get into that, Toya,
first things first.
Hey,
housekeeping. Housekeeping. So first of all, we wrapped up our First Start Challenge.
Shout out. Let's give it a round of applause to everyone
that completed the First Start Challenge. We wrapped it up last week and then added a bonus week, which we had so many people continue on. We added this bonus week for so many reasons, but one of the biggest reasons was because of the community that the First Start Challenge created. And I think some people we probably had the highest success rate in terms of people finishing the program. And I think part of that was the community. We changed things this time in terms of the Facebook group and the app community group. And I think it allowed people to find motivation within each other. So we added that bonus week to kind of keep the trajectory going. And a lot of people crushed it, finished it.
For sure.
The results were amazing. We're going to post some of the results soon. But the First Start Challenge was one of our most successful challenges in terms of people finishing completely.
For sure. And I think the community is like a big point you mentioned. The community helped people feel like they were not alone. I know a lot of people, and especially if you bought the one-time program and you finished it, congratulations to you as well. Especially not doing. Sorry if our throats. We're struggling with allergies. So if you hear us like coughing, doing that stuff, we apologize for that in advance. But back on point with the challenge, I think the sense of community helped a lot of people. But shout out to the people who did the one-time purchase. You had no really that external motivation, and you got through it. So shout out to you. But also, we decided to do the bonus week because literally, I think it was like week 2 or week 3, people were having so much fun with the program. They were worried about what to do after, like 2 weeks into the program. And we were like talking about it. It's only 4 weeks and it went by so fast. And me and Tori was like, you know what, let's just, we spent a whole week shooting and filming some workouts and creating an extra week of programming just so you can just have that buffer week just to kind of help you understand give you opportunity to fill out what you want to do next or create a plan for yourself. I think a lot of people were so focused on that week 4. We knew that most people wouldn't have a plan moving forward. So for a lot of people, we wanted them to use this bonus week as obviously another week to continue on, but also use that week to really figure out, all right, what trajectory do I want to go on for the rest of the year? So that was huge. And we're excited about everybody who's doing the bonus week. So go check that out. If you did make the one-time purchase, unfortunately, that is only packaged into a 4-week program. So you will have to go on the Juice Toya app to access that. But the good news is you can get 7 days free. So if you want to just do the bonus week and cancel, look, we don't mind. I'd do the same thing too if you don't want to commit to
If you don't want a subscription.
Right. If you don't want a subscription, you can just do that bonus week and you'll be good to go. So what do we have next? That's a big one right here.
That leads us into that buffer week kind of also gave us a chance to put our next thing together, which is we are going to put Level Up 2.0 into a challenge.
Oh my God.
So if you've been following us for a while, you might have already completed Level Up 2.0. It was an 8-week strength and conditioning program that we did last year. But at that time, we didn't do it in a challenge. We dropped the program And, mostly people completed it on their own and somewhat in a community fashion, but we didn't do a challenge out of it. So now we are going to do a challenge out of it. And one of the reasons we did this was because Level Up 2.0 is a circuit training program. It's not follow along. There are follow alongs mixed in, but it is primarily circuit training. And the amount of circuit training challenge competitors we had on the fresh start it blew us away, honestly. We thought majority of people would want to do the follow along only. And the amount of people that chose to do the circuit style was like, we loved it. So we were like, let's try to put the Level Up 2.0 in a challenge because so many people now are new to circuit style. So that's what we're going to do. It is available for a one-time purchase or you can access it on the app. So if you're someone who completed the First Start Challenge on the app, you don't need to do anything extra. The Level Up 2.0 is already on the app for you. If you purchase the Fresh Start as a one-time purchase and you want to purchase Level Up 2.0, you're welcome to do that as well. So we'll be posting more details about that, but we're going to start that on Monday the 19th.
Yes, I was looking for that. I was looking at the calendar. Yeah.
So Monday the 19th, we're going to start that. So we'll be posting more details. So you might already even have the Level Up 2.0. You might have already completed it, but now we're going to do it in a challenge. And so we'll be doing it more community style, giving out some prizes and doing along with you all.
And I don't know if you mentioned this is an 8-week program. And another reason we did this is because this is the time of year where we've already seen it at the gym. We've been going to the gym and it's kind of starting to get a little empty in there. People are falling off. That hype is starting to die down. So we really want to keep that motivation high, keep that, we want to keep you motivated toward reaching those goals and not falling off mid-February, early March, right? We want to push you through those months because honestly, if you've been following us for a while, we have a cycle of how we put out programs. We do the New Year program, get you going, then that's that dead period. Then we come back with the Summer Ready Challenge. We want you already summer ready in April, right? We don't want you cramming to get your body right? We want you focused on your body and staying consistent and utilizing that time to really build a routine. We talked about routine. The more you have that routine, the more you're comfortable with it, those results are going to happen naturally. It's not something that you have to just hyper focus on all the time. So this will kind of carry you through that dead period. And then, if we do decide to do another challenge at some point,
you'll be ready.
You'll be ready to go. You'll be ready to crush it. So Level Up 2.0 challenge coming to you soon, February 19th. You heard it here first, probably. So, all right. I think that's pretty much it. Go get your merch. We always say that.
Of course.
Got some new merch coming. I don't want to reiterate that every single time, but new merch coming. Appreciate everybody who has gotten some new merch with us. And with that being said, let's talk about some knees today.
Let's get into it.
So the reason we brought this topic up today is because, number one, I have struggled with knee pain. It's probably the most common joint pain or common injury that we have just kind of seen over the course of time, whether it's with our clients or whether it's through the YouTube comments on our app community. A lot of people struggle with knee pain, knee weaknesses, stuff like that. So today we want to address a lot of different things, mostly how to either avoid knee pain or how to even fix it. With some simple practices that you can just do at home. These are things that some of these things you don't have to pay any money. You don't have to, empty your pocketbooks just to fix your knees. A lot of these are simple practices that you can make that can just at the very least alleviate some of the pain that you're having, because knee pain comes from so many different places, and we get comments all the time. How do I fix this with my knees? My knee hurts with this. And it's so hard to answer that. And usually we tell people, you might have to do some sort of consultation, or we even recommend them to a PT, just because we don't have that expertise in the sense of understanding where that knee pain is coming from. Sometimes I can ask a few questions and find and pinpoint where it's coming from just things that you're dealing with. But in most cases, it comes from so many different areas. It can come from an old injury. It can come from tightness. And we'll get into what that knee pain is coming from. So today, we want to address a few things. One, obviously how to alleviate that knee pain. But two, reasons you should not avoid exercises that involve the knee. Because that's a big common thing too. People ask us questions like, what can I do in place of this? What can I do in place of that? And a lot of times it's the most functional movements that are knee dominant, which is a squat, which is a lunge, right? So we don't want you to avoid these movements. We want you to fix the knee.
Yeah, because those are everyday movements. Walking upstairs, sitting to a toilet, like that's squatting. You're bending the knee, so you're not going to avoid those things the rest of your life, right? No. And we also want to preface this by saying too, like these are just like scratching the surface of things you can do. There are a million other things. You might try all these things and nothing works for you, but something else does, right? And we might talk about some things that could be causing it, but it might not be what's causing your knee pain, right? So these are just things that maybe we've both had knee surgeries. We've both done some type of athletic sport that involves an injury to our knees. And just we've gone through rehab, PT, surgery.
We've seen it all,
fixing things. So just things that personally might have worked for us. But again, that does not mean it's going to work for you. And you might have something completely different than what we list here. So always keep that in mind too. And we say the same thing on our app when people, like he said, we get questions all the time. We can't diagnose. I'm not a doctor. I'm not a physical therapist. I'm not a chiropractor. Like I can't, like, even if you tell me some things and maybe I've seen it before, I can't diagnose that's what it is. I might be able to give you some tools, but when I have knee pain, I have to go see someone, you know? Sure. So, again, keep that in mind that just a little disclaimer. We are not physical therapists, doctors. Yeah.
But we're just teaching you from experience. Again, we've had our pains, and things that have worked for us over time. And a lot of the things that we're mentioning today are, things that, again, are easy practices that when I was having knee pain, I did these things, made them a part of my routine. And now sometimes it gets to a point where I'll feel knee pain and I know exactly what it's from. Right. So we're just here to just give you some awareness of where your knee pain can be coming from. And hopefully for some of you listening to this podcast, this will help you in a way. Hopefully you learn some of these tips and you're like, wow, that completely helped my knee pain. And sometimes it's just so simple, I think, and you'll learn. You know, some of these might sound cliche or simple, but it is the simple.
Really simple.
It's usually the simple things sometimes that we're not doing that can really help our knee pain. So just to get into it, before we get into it, another thing I want to talk about is age, because I think a lot of people associate, especially with certain movements, like I can't.
100%.
Toya has a pet peeve with this. Some people associate not doing certain movements with their age. So another common comment that we get a lot, especially on our YouTube, is, do you have any exercises for lunges? I'm over 50 and I shouldn't be doing these lunges, or I shouldn't be doing squats. They're bad
because I'm 50.
Or, because I'm 50, or they're bad for my knees. And that's the relationship that we want you to break, right? Squats are not bad for your knees from something completely associated with that, but that's not the source of your pain, right? So we want to get out of the age talk too, because even with our more high intensity or higher impact workouts, we have people 60 plus doing those workouts, right? So,
or can you make workouts for people 50 plus or 60 plus? And I think what I sometimes I'm like, what does that mean truly? Because like when you say like, can you make a workout for people 60 plus? Is it because you're saying, oh, this workout has squats and 60 plus isn't supposed to squat? Like truly what does that mean? Because like we said, we have people from all ages who are doing like things you think would be bad box jumps, like swings, kettlebell swings, lunges, split squats, like, and it's plyo push-ups, like all of these things. So clearly the age is not the limiting factor. So I think just getting out of that mindset. Now, with that being said, if you've had a significant injury at an older age and it took you a long time to recover, you might have a fear of doing certain things just because it may take you longer to recover and harder to recover and things like that. But that's a whole different thing. And even in that instance, there shouldn't be a workout for the age. It should be a workout for your limitations or a workout you just might need to modify some of the things. So, which is totally fine. So I think sometimes that question, I'm like, what does that mean? Like 60 plus? Because everyone that's 60 is not the same. The same way that everyone that's 20 is not the same. So you could be 20 years old and have more limitations than a 70-year-old for whatever reason, right? So, All
right. So with that being said, let's go into, we're going to give you some tips. I'll say we have about 8 to 10 tips that we want to give you to sort of just attack your knee pain head on, something you might be overlooking, something, somebody might have told you along the lines that, we might be reconfirming what you can do to help fix that. So
Yay.
first and foremost, this is a huge one. This is something people overlook every single day. Even me, myself.
I just raised my hand.
We admit that
Yep.
we, sort of underestimate how much this can sort of alleviate the knee pain. Whether it doesn't matter what we're doing, whether we're running, lifting, working out, or just getting out of bed. Some days, like sometimes I'll just wake up with knee pain and be like, "Yo, bro, like, come on." I know I'm 30 plus, but Jesus. But stretching and mobility work is huge. So if you're someone right now who struggles with knee pain, just ask yourself, are you stretching enough?
Are you working on your mobility?
Are you working on your mobility? Are you working on your hip mobility, right? All of those things. Think of the knee joint, right? A lot of people think like it's whatever's causing the pain it's because of the actual joint.
Yep.
But you got to realize, think of all the different attachments to your knee joint, right? You have your quads that are attached to your knee, your hamstrings that are attached to your knee, your calves that are attached to your knee, right? And they're also influenced by your hips. If you have tightnesses in your hips, right? It's a huge chain. I want you to think of the body as a chain, right? I've seen instances with a few. I had a client once who he had chronic calf pain. Like he always had pain in his. He had chronic knee pain, and we did a lot of hip tests. His hip mobility was great. I was like, well, it's not coming from your hips. Your hips are great. His hamstring flexibility was great. Even his quad flexibility was straight. But his calves, when we did the what's the test where you push your knee toward the wall, just the ankle mobility.
Yeah.
Right? We did an ankle mobility test, and he could barely push his knee forward to the wall. And I was like, wow, your calves are extremely tight. And we loosened his calves probably over a 2 to 3 week period. And he didn't even mention his knee pain. One day I asked him, I was like, yo, hey, you still having some knee pain? He's like, yo, I totally forgot about it.
Yeah.
Right. So the knee can be influenced by so much, but in a lot of cases, many people overlook the power of how much stretching on a daily basis can really help alleviate the tension that the muscles are pulling those joints. If you have a tight hamstring, right? If you have tight calves and tight hamstrings and tight quads, those muscles are constantly pulling on that knee joint, which of course, if you have tension, there's going to be some knee pain in there. Yep. So don't undermine, the power of just consistently stretching every day. And that's the thing too. I don't want people to think like, it's hard to stretch every day.
Right. Yeah.
It's hard to make that consistent, but at the very least, I want you to focus on the areas where you need it more than anything, right? If you know
add it into a warm up, add it like your mobility work.
Correct.
Like it doesn't have to be. I think sometimes people think it needs to be like a 20-minute thing. Like don't underestimate like the power of like a quick 10-minute stretch session, which before bed, do some mobility, like choose, like you said, focus an area. Like I'm going to do like a 5 to 10 minute hip mobility tonight. I'm going to focus on my thoracic mobility. Like choose an area and focus on that in that time and do something every day. And it adds up.
Yeah, for sure. And the one thing I also want to reiterate too is just the importance of warming up. So with our workouts, yes, we try our best to include warm-ups in a lot of our workouts, but that might not be enough for you, or that might not be the exact warm-up that you need. Within my own personal warm-up, I warm up, pretty much obviously every muscle in my body, especially if I'm doing a full body workout. But I have 3 exercises within my warm-up that are solely focused on my hamstrings.
Yeah.
Right? Because I know my hamstrings can get very tight at times. And I have exercises that I like to throw into my warm-up to ensure that if I have any pain, it's not going to be caused by this because I spent so much time on that. So,
and think of your warm up as movement prep. You're literally prepping your body for whatever you're doing. So
important.
If it's a full lower body workout, like the warm up we do on the channel is probably that full body warm up we do is probably not going to be what you want to do for a full heavy lower body day, especially if you're doing some explosiveness in there. You want to like fire those fast twitch muscles. You want to make sure your hips are opened up. Like it's not just like a quick 2-minute thing sometimes, so
think of and I'm glad you said that. Think of the warm up as part of your workout. I think a lot of people just, how many of you can raise your hand out there. How many of you just skip the warm up and just go to the workout because you want to get
just
the workout.
walk.
Or
Like you might just like do a quick little treadmill walk and then you jump into the workout.
Yeah,
right.
Like that can be an easy cause of that knee pain there because you aren't prepping those muscles for movement, right? So we always tell people, yes, we include our warm ups in our videos, but we want you to create a warm up routine that works specifically for you and your body and what you need. We don't know what you need, so we try to include full body movements that kind of help warm up everything. But, you know, if there's something that you need to spend a little bit of time, like I warm up for almost 15 minutes before every workout.
Yeah. Pause the video and do your own movement prep.
And I get it. We all don't have 15 minutes to warm up. But again, make the warm up part of your workout. Sometimes I do a warm up set of squats, or I do all of the movements that I'm doing for a workout without any weight, just to kind of prep my body to say, all right, we're doing squats today. Let me just get into the rhythm or get into the movement pattern of what I'm going to add a resistance to, if that makes sense. So again, number one, the first thing you must focus on, if you haven't done this probably will help 50% of the people listening to this, just because stretching will just help alleviate any tension within those muscles that could be pulling on those joints. And that goes for anything too, not just the knees, the hips, the shoulders, right? The wrist. Sometimes people have wrist pain. You can have tight forearms. This is something that a lot of people often overlook within the forearms.
What'd you tell me today?
Literally.
I was doing push-ups and every time I bent my wrist, my hand went numb. And the first thing he said was, are your forearms tight? Like he didn't say like, oh, you have an injury, or oh my goodness.
Oh, your
like,
wrist must be messed up.
Yeah, immediately it was like, are your forearms tight? And I was like, probably. And that was it. That was the end of the conversation.
Because how often do you do mobility or stretch work for your forearms or for your wrist, right?
I do them when we film.
So sometimes you might go into a push-up and be like, right? You hurt your wrist because your body wasn't even prepped for that. It wasn't prepped for that flexion
I did
in the wrist. You know what I
a
mean?
lot of warm-up for my upper body, worked on my thoracic, mid-back, and my shoulders and my lats, and did not do anything for my wrist. So that definitely is important. And that kind of leads me, I'm going to jump into this one, different forms of recovery or stretching and mobility. So foam rolling, using massage guns, getting a massage, using what's the little ball?
I mean,
the ball.
you can use a tennis
ball,
golf
lacrosse
ball.
Yeah, like getting into deep, like really, really deep myofascial release, or even just like more than just like holding hamstring stretch, right? So those different forms of like recovery for your muscles can be a huge help too, because you might say like, oh, like I'm stretching and I'm stretching every day, I'm doing mobility every day and it's still not working. You might have so much built up like tension and knots and things that just need to break up and loosen, to where that stretching becomes a lot more beneficial as well.
Yeah, and we can go a little bit into myofascial release, which some people listening to this might not even know what foam rolling is, or you might see people doing it and you've never done it before. But foam rolling is an easy way. It's very inexpensive too as well. If you need a foam roller, get one off Amazon. I would probably start with the softer one if you've never foam rolled before. We have a foam roll video on our channel just to kind of guide you and help you with foam rolling. It's a great way to just sort of release a lot of tension. So what happens is, if you don't know the anatomy of muscle fibers, and if you're watching this, you can probably see this, but muscle fibers are kind of like just kind of connected linear fibers together. And sometimes when you work out a lot and you're pushing yourself, that fascia it knots up, or it gets really connected together, and you need something to kind of break it up, which is why a lot of people foam roll before they stretch, because it helps break up some of that fascia before you want to kind of open the muscles up, lengthen them, and get that blood flow within the muscles as well. So it's very important. Again, myofascial release, you can do it in a lot of different ways. You can obviously, foam roll is the most simple way to do it. They call it the poor man's massage.
Sometimes like that spiky one, that has helped alleviate migraines for me. I just I'll show you one day, but it like the foam roller can do wonders. Like,
I'll show you one day.
I'm serious. I said I'll show you because I don't even know if I was supposed to be doing that, but it worked. I just put it at the base of my neck and it relieved my migraine. So
neck tension.
Tension.
It's easy. So there are a lot of different foam rollers. They have some that are smooth, some that are soft, some that are spiky for more advanced people who look. I've been foam rolling for 15, 20 years, I feel like. So that spiky foam roller, I've worked my way up to that. But you definitely got to work your way up to it. It is very painful, but once you do it more often, it's one of those things. It's good pain.
Yes.
Like it kind of feels, it hurts, but it feels good because you know things are breaking up.
But I had a client once that refused to foam roll because she was like, it hurts too much. It hurts. And I'm like,
that's the issue.
But and you might need to do some other things first. If it hurts so bad you can't foam roll, like you got to find some ways to break it up. And like maybe that's where like the massage gun might be good to like start softly, or getting a massage where they can apply like soft pressure and get it built up. But then don't let it get that bad again. You know, like if it hurts, not even gonna lie, it's painful.
It's going to be painful
if you're really locked up. Like my quads, that spiky one on my quads is torture. But that's when I'm like, oh man, it's my fault. I haven't been doing it.
Especially when you're sore.
Oh my goodness.
There have been some days. I already know tomorrow. Today. I had a crazy leg day yesterday, and I went straight for the quads today, and I knew what to expect. Now, man, it was
I've
tough.
Literally had a tear come out. I'm not exaggerating.
Yeah. But I can only describe it to you. If you do it, you understand. But the feeling after you do it, it hurts, but you feel a lot just more free. You just have a lot more freedom within how you move, even just after foam. That's not even including the warm up and doing some dynamic stretching, right? So that is just an easy way. You know, they have some foam rollers literally on Amazon you get for $10. Start with that, and once you get accustomed, my favorite thing honestly to do with a foam roller is to crack my back.
Or I like doing like T-spine mobility and like opening.
Like with any type
of
T-spine. Yeah. If you have back pain, if you have just a lot of tightness, like she said, she alleviated a lot of neck tension.
Literally
that was causing migraines just from doing foam rolling. So see how easy of a fix that is.
And we don't mean to scare you. Think of it as like a deep tissue massage. In the moment, a deep tissue doesn't feel good like just a regular. It's exactly like that. Where in the moment you're like, oh my goodness, like I want to tell her to slow the pressure down, but I know I got to get it out. Yeah. And as soon as they leave the room and you're laying on the table like, woo, I feel better. It's the same thing.
For sure. So focus on those basic forms of recovery. And then also too, if you have, like she just mentioned, if you have the means to do a massage, I always recommend people do a massage at least once a month, because think of how much, demand we put on our bodies on a daily basis, especially if you're someone who works out 3 to 5 days a week. That's a lot. We're asking our bodies a lot on top of the things that we do on a normal basis within our normal schedule, right? So, if you can have the means to get a massage or some type of sports massage at least once a month, it makes a huge difference. This is something, man, like I need to, like
we need to practice
every time we get a massage, it's like, man, why don't we do this even just once a month? Like, it might be anywhere between $60 and I've seen up to $200, but it's worth the investment if that saves you a lot of pain moving forward, and it allows you to, again, you're able to attack these workouts. You're able to do things a lot more freely just because you're not so locked up all the time. So follow those basic means of recovery, and I guarantee you, you'll at the very least see some type of improvement, especially if you're experiencing some pain. So good point. Good little jump there. Next, this is another one. A lot of times when people have knee pain, this is probably the second most common from not doing stretching or mobility work, and that's doing the exercises incorrectly. Form is huge. The thing I worry about sometimes when we put our YouTube workouts is, and this goes for our programming sometimes too as well, there's some exercises that we would love to include in our workouts, but we don't feel comfortable enough that the general population will do this correctly, because we try to program things in a way that keeps you safe as well too. So there's some exercises we want to, and a lot of times we label it as advanced. And if we put advanced in our workouts, we're more so targeting the audience of people who are familiar with how to do certain movements, right? So if we're doing it, if we call it advanced, that means you understand how to move your body. You understand movement. You understand how to do the exercises correctly. If you do one of our advanced workouts and you're kind of a beginner, it might be some exercises in there that you could potentially be doing wrong, and that could be something that causes the knee pain. So a big example, I wish we could show you here, but a lot of times when you're doing a squat or you're doing a lunge, a big thing I see a lot with those movements is the knee sort of caves inside. So if you're watching this on YouTube, check out my knees here. So if you're doing a lunge and you step forward, whether you're doing a reverse lunge or a forward lunge, a lot of times the knee likes to cave in. I tell people, try to pretend you have a gate on the inside and the outside of that knee and try to keep that knee within that gate, right? The moment it breaks the gate, that chain breaks, right? So if the knee caves in, that can probably send a signal to somewhere where it could cause pain. It could go to your hips. It could go to your ankles, right? So we don't want to sort of influence other muscles when we're doing an exercise that's supposed to target a specific muscle. So with a lunge, we're targeting the quads, we're targeting the glutes. The moment that knee caves in or caves out, now we're influencing other muscles
going
to
like
work.
An adductor.
Exactly. Yeah. We're overcompensating with other muscles, and we're not working the muscles that we should be. So that's one of the most common ways that people experience pain with movement. Same thing goes for a squat as well. People will do a squat, and the first thing that happens, those knees, the knee knocking, right? Right. So if your knees are inside of your ankles, that's an issue when you're doing squats. And a lot of times that's, that's where people blame the exercise and not the form and the movement of it.
And the other thing could be where you're shifting your weight too. And so there's types of squats where your weight is more shifted forward. It's more quad dominant. But in majority of cases, like shifting back a little bit more, you don't want to feel like you're falling backwards, right? But just kind of shifting that weight or like having even distribution throughout your feet too can make a world of difference. And a lot of times when we first start with clients and we're like, okay, let's see like what a squat looks like, almost every single time the heels come up and the weight shifts forward to the toes, and then they stop and they're like, my knee hurts, I don't squat, right? And so there's common things where you can just shift the weight, sometimes have them squat back to a box, like kind of just distribute some things and the knee pain is gone, right? And so a lot of times it could be a form issue. And this goes for more than just knees. If you say deadlifts are bad because you feel your back. Right? They're not bad because you feel your back. You're doing them wrong. And now you feel your back, and that's your association with deadlifts. So a lot of times it's not the exercise. It's just the form in doing them. And it was like that for both of us with common things.
Man.
I think I said this the last podcast. I didn't deadlift for so long because I only felt my back. And I knew I was doing it wrong. And until someone properly taught me, and even all the times people would try to teach me, it was like fitness bros and like, just lift the bar up. Like it wasn't like this is where seriously
lift the bar up.
But it wasn't like for me, if someone would have been like hinge from your hips, not use your back, or like slightly bend in the knees, or like use your glutes, turn on your glute, like all of those things. To me, once someone was like showed me that, I was like, oh, my glutes are doing the work, because I thought this was a back exercise.
Man, I thought that for the longest.
For
like,
a
I
long
thought deadlifts
time.
was a lower back exercise because it's all I felt.
That's all. Tire flips. I need to find this tweet where I was like, did some tire flips today. My back is killing me.
On fire.
No pain, no gain. Like, no.
Look, my back is on fire, y'all.
So,
I'm loving it.
And so if you don't know, like that's what you associate it with,
for
So
sure.
we thought the same thing. So until you learn, and how can you learn if no one ever educates you, So sometimes I think people associate knee dominant exercises with, I can't do these because I have bad knees, because they think you should be feeling it in your knees. And you shouldn't, right? Because that's what I thought with deadlifts, know. So a lot of times just a minor change in form can make a major change in where you feel the exercise.
And don't let anybody tell you that deadlifts are bad.
Please.
Again, it's a functional movement. When you pick up something off the floor, you're doing a deadlift pattern, right?
Picking up a box.
Right. If you bend over and arch your back, that is the improper way to pick it up. And I've seen cases where people bend over, and you've had a client that bent over to pick up it's not something heavy. You can just be picking up a piece of paper off the ground, and then,
and if your hamstrings are tight, your hips are tight, and then you pick up and something's pulling as you're trying to pick it up.
I've seen it time and time again.
Time
and time again. And even the people who are strong, myself included, like I've had clients who deadlift 200 plus pounds and they bent over incorrectly to pick something up and threw out their entire back, right? So deadlift is a functional movement. It's something that, especially with our older clientele as well, like we try to, we do deadlifts is one of the most common exercises that I do with it. Deadlifts and squats.
Yeah.
If you can do deadlifts and squats properly, you're in good shape because those are the most common functional movements that we do every single day, whether you think or not. Like we do them every single day.
Picking up your kid.
You're picking up your kid. That's a hinge, right? That's a deadlift. It should be, right? So again, these are all functional movements. Most of the strength exercises that we do on our YouTube workouts are all functional toward doing something, right? So we want to get you into the pattern of figuring out what you can do to do the exercises and not avoiding the exercise that could be potentially helping you in the long run. You know what I mean? So
100%.
all right. So that's the another thing too is I wanted to talk about and I know we kind of mentioned this, but the power of just overcompensating too as well. Well, I guess I can kind of move into that goes to the next one. So I'm gonna skip ahead. Is that next?
That's next. Yeah.
So let's talk about imbalances.
Yes.
Because this is something that I think people don't really know about, and it's a huge thing. But a lot of us have imbalances. As long as you have some sort of dominant side, you have, even if it's just the slightest imbalances, everybody to some extent has an imbalance. So for example, everybody says that everybody has a bad knee, right? Or everybody has a bad shoulder, or not everybody, but I'm saying generally speaking, like
Mine's my left knee and my right shoulder.
you know which knee is a lot more stable than the other. You know which shoulder is a lot stronger than the other, right? Again, like I mentioned, the body is a chain, right? So when you have imbalances from left to right, I've seen something that where people had imbalances in their feet and it works all the way up to the lower to mid back. Because if you have imbalances in how you walk with your left or your ankle mobility on your right side, and you're wearing shoes and you're walking all day, that could shoot pain to your left hip, which could shoot pain to your right lower back, which could shoot. I've seen it go all the way up to the upper body, right? So you want to make sure that you're improving those imbalances. So one of my common ones is I have a weak left glute, at least so I've been told. And with certain exercises, I struggle with single leg deadlifts. I struggle with step ups sometimes because my glute is so weak on this left side. My knee likes to cave in a lot, and that creates imbalances elsewhere. And I feel it in certain exercises. So this is also where the reason we include single leg and single arm exercises in our workouts, because we're working on improving those imbalances if you have them. So one thing in regards to resistance, we highly recommend if you struggle with lunges, you should be doing lunges with no weight.
Yeah.
Starting off, right? We don't want you struggling with the lunges and now you're adding resistance to something that you're not even doing properly, or you have an imbalance in this leg and you're loading one side probably more than you should be loading that side, right? We always recommend start with body weight with a lot of these exercises, and also to allow you to feel the imbalances that you have. So if you're using, let's say you get lunges down and you've done body weight for a while, once you feel like you have some symmetry, then you can go up on weight. And the same thing if you are using weight and you feel like one side is weaker than the other, do not go up in weight until you feel like both sides are strong enough to be able to handle that weight with certain exercises. So that's the importance of doing unilateral exercises, which are single leg deadlifts, lunges, reverse lunges, lateral lunges, stuff like that, because it's important to train those sides individually, just so you can see, like, do I have any strength imbalances on my left to right? Because those can be something that cause knee pain as well. Sometimes your knee pain can come from the other side of your body. Yeah. Right. I've dealt with that a lot of different times. So imbalances are huge. You want to try to maintain symmetry as much as possible.
Yep. And also when there is an imbalance or a weakness in general, something else is compensating, right? And so I also have a weak left glute. Must be something that we're doing in this house. But for my left adductor is so overactive. I feel it with anything that I do. And I know a lot of that is my weak left glute. And so if I would just take the time to properly strengthen that, it would probably fix a lot of things. Easily. So that's something I've been incorporating and working on. And with that also being said, a weakness in general in your glutes and your hips and so many of your lower body can cause so much knee pain. I did 0 strength training while I ran cross country and track, besides the strength and conditioning I did in high school, which was a 50-minute period,
Yeah.
including the warm-up, cool-down, change, everything. So there was, and it was like
Probably
once a week.
20 minutes of extra work.
Exactly. And it was like a 1 rep max each time. So
okay.
I did 0 strength training
Yeah.
and ran miles on top of miles every week.
Yeah.
Guess who bought probably 6 different knee braces throughout my running career because I had knee pain constantly.
Yeah.
Knowing what I know now, I had weak everything, weak
Yeah.
glutes, weak hips. I did 0 strengthening. All I did was run. And don't ask me if I did mobility
Oh,
because I didn't. It was like
Yeah, right.
that, run 2 laps around the track, hit a couple stretches and be out.
Yeah.
That's what it was. So there was no proper mobility. I did 0 strength
no proper
training.
warming up.
No proper warming up.
Yeah.
And even going into college, I did 0 on my own, none. And then once I started strengthening my quads, my glutes, my hamstrings, and this is why I say I wish I wouldn't have had my knee surgery.
Yeah.
Knowing what I know now,
Probably
I
could've
didn't
fixed
need
it.
it. I
Yeah.
didn't need it, right? And it just made things worse. That's a whole nother podcast. So a lot of times the weaknesses can cause your knee pain too.
Say it one more time.
Weaknesses can be a huge cause of knee pain. So hip weaknesses, like your hip can be weak, not just tight. It can also be weak. So sometimes it is frustrating trying to figure out, is it weak or is it tight or is it both? Because if it's not tight and you're doing all the stretching, and that's not the issue, it's not fixing anything.
Exactly.
It might just be weak and you need to strengthen it. So sometimes it is frustrating with the trial and error of trying to figure it out. And that's where a professional can come into play. But even then, sometimes it takes them some time to look at your movement, give you some homework. You report back and they're like, oh, okay, it's not this. So sometimes it takes, listen, if you've been having chronic pain for years, you can't expect someone to just fix it like that, right?
I wish it was
Sometimes it
that
takes
easy.
some time. Because that's the other problem is someone might say, okay, try these strengthening exercises. It doesn't work. And then they give up seeing that person
for
when
sure.
you just got to try to trial and error it sometimes.
Like if you train with us, let's say you train with us for the first time, that first session, we're not touching a single weight. The first session, I'm looking at everything. We do pretty much like a full body assessment to see all of the functional exercises that we mentioned. Can you do those properly? And if you can do those properly, we can load it, right? If you can't do
So
it,
you might touch away if you can do it properly.
Yeah.
Like you load it
if you can,
right.
if you can properly squat, or you can, and sometimes we've seen instances where people have the mobility or the ability to squat, they just don't know how to do it, and then we correct them and they can squat, and then we
Perfectly
can properly
fine.
load it, right?
Yeah.
But again, if you're loading in exercises that you're not doing properly, that's going to cause even more imbalances and more pain over time. So again, start with body weight, and once you're able to improve, especially squats, right? If you struggle with squats, and you probably look at our workouts like, oh, more squats. Why do they keep doing squats? They're bad for my knees. They're not bad for your knees, right? We need to focus on what we can do to improve it, and at the very least, modify. And we'll get into that topic. But let's go to the next one,
Which we kind of already mentioned
we kind of already
a little.
mentioned with the training.
Work with a trainer or movement specialist.
Yes.
So this can be anything from hiring a personal trainer to sometimes the trainer might refer you to a PT, and sometimes you see both.
I do it all. We do it every day.
Every day, where if my client has an issue that it is not my expertise, I refer them out. That doesn't mean we can't still work together in continuing your program, but we might just need to modify until your PT says you can do this, and this, or you figure out what's going on. He went through PT with his Achilles. Does that mean he has to stop working out while he's seeing a physical therapist? No, So seeing a movement specialist, and this is really important because we get messages weekly, daily. Of people saying, my wrist hurts when I do this. Should I stop doing this exercise? Or my knee hurts when I do this. What should I do? As you've heard in this podcast, there's a million and one things that could be causing that. Your calves could be tight. Your hips could be weak. Your glute could be weak. I don't know. So I know it's annoying when we say, gotta go see someone, but truly I could tell you, oh, your knee hurts because your left glute is weak, because my knee hurts because my left glute is weak. So do these glute strengthening exercises and your knee will feel better. What if your glute's not weak? Right? And what if your glute is actually very strong and now you're just making things overactive? So this is why we say that. It's not because we don't want to answer your question or we don't want to help you, but truly we could be putting you in the wrong direction. If I tell you your hip is tight do a lot of mobility and stretch every single day.
Yeah.
What if you already have a lot of hip flexibility and now you're just making things hypermobile and now you're losing stability?
Yes.
Right.
It's a whole like whirlwind. It's a circle effect. But that's another thing too. I know people are thinking like, well, I can't afford a trainer or it's hard. Sometimes, and I've seen cases, and when we train, especially at a gym, I've had clients for literally 2 sessions sometimes, because sometimes you need someone to just look at you.
Take a look at you.
You don't have to hire a trainer full time to train you
Yeah.
every single day or every single week. Sometimes you just need to hire a trainer to say, look, I'm weak here, or I have knee pain here. I struggle with these certain exercises. Can you take me through a workout to where you can check over my form, take a look at what I'm doing, maybe take me through an assessment to see what I could be doing wrong or what areas where I need to improve? And a lot of times when I've personally done those assessments, I've walked away knowing what I can work on or things that I can do to improve it. In most cases, I work on those things and it's like, boom. It might not have completely knocked out the issue that I was experiencing, but it got me in the right direction, right? Or it gave me some information that I didn't know before I showed up for that session. So sometimes, I can't tell you how many times we've done sessions with people where they've literally only trained with us one time, or they do a assessment with us and they walk away from it with so much information. Yeah, just some information on how to attack that whatever pain that they're experiencing, especially with the knees. So again, sometimes it's helpful if you have a trainer or a gym nearby, and there's even people who do virtual sessions where they can look at you in different angles, just to kind of see like, all right, how do you squat? And just look at your raw form, and they can make improvements with that. It's just simple as that.
And one last thing on this, on that topic is a lot of insurance now will cover physical therapy, and some I've even seen they have a stipend for personal training, or I think like just health clubs is what they say, but then I think you could use that towards like, it might only cover a couple sessions a month, but like you said, if you just need someone to check in with. So it's also worth checking with your insurance to say, do you cover any type of PT? And I know sometimes you have to have a referral, but if you go to your doctor and say, hey, I'm having bad knee pain, that should probably be the first thing they refer anyways. Is like, okay, let's check it out and see. Let's refer you to PT. So sometimes if you get a referral, the insurance will pay for it. So don't even get us started on insurances. And we know they're frustrating, but sometimes it is worth it to just check, just see. And like sometimes they cover it, and that would be wonderful, because then maybe you even get a little bit more out of it. And then maybe they fix more than just your knee. You might find something out of that PT that you realize, will help you outside of the knee. So, and if it's paid for, why not?
Why not? Exactly.
Why not? Cool.
So cool.
And then the next one we also talked about, and so this will be a quick one, drop the weight, focus on body weight and form. Like he said, you don't want to load something that is broken. Right. And so there are some exercises that I've actually found with our clients, they're doing it wrong because it's too light. So kettlebell swings, deadlifts are another one where I'm like, do you feel your glutes? And they're like, no, all I feel is my back. And then sometimes you go heavier and it kind of forces you to engage your core.
Because you feel the weight. So you feel how, the weight distribution, how you kind of have to load it. If it's too light, sometimes you can get away with bad form because you don't really feel it in the movement.
Yes.
But when the weight's heavy, you kind of feel like, all right, I have to adjust my body, shift my weight back a little bit. I have to engage my core sometimes. So that's another thing. That's another reason why we encourage people to go a little bit heavier sometimes, because sometimes you don't know, the correct form until you're using a weight that's proper for that movement. So
like you said, I should feel deadlifts in my glutes. I don't feel my glutes. I don't feel my back, but I don't feel my glutes. That's usually a sign, go heavier. You can handle more resistance. So anytime you feel, if I feel like something is wrong or my form's off, I kind of back up and I do the form by itself, and I'm like, okay, let me see what's going on here. And sometimes I gotta put my pride aside. It's too heavy, and it's too heavy for me to do it correctly. It is tough, but then it makes you work harder to get to that weight. And yes, I'd rather go down on weight than have an injury trying to look like Superwoman in the gym. So,
all right. So the next one, and I'm gonna say this is like, I'm trying to say this in an appropriate way, but we've had clients of all different shapes and forms. If you're someone who, if you're overweight or you struggle with obesity, losing weight will make a huge difference. So think about, I always tell people too, and a lot of people who've lost a lot of weight can probably associate this with a lot of things. So let's say you're, I don't want to get into BMR and all that stuff, but if you're someone who's 5'9", let's say you're my height, 5'9", 5'10", and you're 300 pounds, right? You're probably about 120 to 130 pounds overweight as far as ideal body weight standards. Think about if you got 130 pounds of excess weights, think about how much more stress that puts on your joints and your muscles, right, on a daily basis, right? I've had clients, they've lost, I think one of my clients, he lost close to 50 pounds, and he said all his pain was gone.
And he was small.
He was
so
not
it's like that 50 pounds.
He was not a big
lot.
guy. He wasn't a tall guy. And so that 50 pounds is a lot on his skeleton, right? So losing that weight alleviates a lot of the pressure that you're putting on your joints, right? It takes a lot of effort to move your body, whether it's just walking or going upstairs, right? That's resistance, right? That's what I think a lot of people think. Think about, I always tell people, if you want to feel what it feels like to just put on a 20 pound or 30 pound weight vest and just feel how much different life is when you add an extra 30 pounds. Granted, it'll probably be distributed differently, but if you just wore a 30 pound weight vest all day, it's every little thing is so much harder because your body has to compensate for the amount of weight that's on the skeleton.
Think
right?
about pregnant women, or if you've been pregnant, why
huge one
like that, all the like low back, you start randomly, like one of the biggest complaints of some of the pregnant clients I've had is like, my joints just hurt. Like, and it's, of course, you know, like you've got this extra weight that you're carrying around every day that just is kind of like been gradually building up. And
it's front loaded. It's like,
and it's frontless. So it's pulling on your back. Absolutely.
I can imagine.
So, think of it like that. Like if you've been pregnant, you probably know, like, yes, like it's just extra pains and aches in your joints that you're like, I can't explain it, but like, look what the difference is, you know? So yeah, absolutely. That can be.
Pain can come from excess weight too. But also another thing too, that's the importance of having strength, right? As well, especially when you're pregnant.
Yeah.
And we won't even get
strong
too
core.
deep into that.
Yeah, that's a whole nother episode. but
if you're,
in general.
Yeah, if you're drastically adding weight to your skeleton, whether you're pregnant or just adding on body fat, having strong legs or strong just body muscles and core in general can kind of make up for that extra excess weight that you have, which again, this is why we tell people to make strength training the foundation of your training, right? Strength training should at least be done twice a week. I don't care if you're training for sport or training for life. Like strength training is very important for alleviating pain, but also just making sure you're strong enough to do functional movements that you should be able to do every single day. So,
we're
going to leave it at that. You know,
cool.
It just adds more stress to your bones and your joints. So,
and this next one, we also kind of touched on this also at the beginning, but warming up before you exercise and cooling down after. This falls into like the stretching and mobility and recovery. We already talked about warm ups, like. He gave you his whole spiel. His was 15 minutes.
I'd be honestly, especially if you're doing a high intensity workout or you're doing like some heavy strength training, like you should be almost sweating like when you're warming up, because again, make it a part of the workout and it's movement prep, right? You're prepping your body to, to attack this workout that you have set up.
And I was that person that I used to just like walk on the treadmill for a little bit as I'm warming up.
Yeah.
My body's warming up a little. And then I would get to that squat and be like, oh, my knees hurt. Like, so immediately, so I had to learn as well, that if you enjoy walking on the treadmill beforehand, please do. Like if that kind of gets your mindset ready to okay, I'm here, I'm at the gym, get your mind right. And then hop on over to that squat rack, do your warm-up exercises, your movement prep, all those things, and then put that bar on your back. Like that's great. So I still sometimes, if I'm like, especially when I'm not motivated, I'll maybe like walk on the treadmill, try to put together a good playlist or something. So that doesn't mean don't walk on the treadmill or don't do cardio before. Like definitely do, but
do things that prepare you for the workout ahead.
Yes, because that treadmill walk did not prepare me for like maxing out on squats.
That's why we tell people too, especially on the Juice Toya app, like look at the workouts ahead of time too as well. So like know what you're getting yourself into, because sometimes, you might look at a workout and it has some deadlifts in there or some squats, and you just might do a willy-nilly, warm up when you could do something like, all right, I see the squats, I see the deadlifts. I really need to warm up my legs tomorrow because I want to make sure they're prepped to do these exercises properly, right?
Yep.
I can't tell you. We always talk about setbacks. We talk about how much setbacks can really just make or break your program or your goals. Those simple things will save you from just the injuries that can happen, right? That's another thing. I've been injured my whole life, I feel like. And a lot of times my training has shifted so much into doing exercises that are focused on injury prevention, or doing movements or movement prep that's focused on preventing myself from getting injured, because I know I come from a sport, or just in general, I come from athletics where your livelihood is your body, right? So if you can't perform, or you're injured all the time, you can't, especially if you're a professional athlete, you can't make money.
Yeah.
Your body literally is everything. It's priceless, right? So if you can do things in advance to prevent you from getting injured, that is going to not only help you reach that goal, because you're not going to have any major setbacks, but also it's just going to just help you just grow faster. It's going to help you reach that goal in a way that's sustainable, but also it's going to just keep you from the discouragement that comes with hitting those setbacks over time.
I got something to say to that point. And shout out to my cool new shirt that I got.
That's a dope shirt. Can I have it?
Yeah,
it's kind of big.
You could actually probably fit this. Yeah,
I need that.
It's an oversized boyfriend tee is what it's called.
Oh, sorry.
But this made me think of LeBron. What was it that he pays like $1 million a year on his body in terms of like recovery? We probably has a massage person come every day.
Got a trainer on call probably.
How many times after, like in the locker room when they do the post game, they're already having like ice, or like trainers are in there already on their calves. Like it's that immediate recovery, and of course, if I could spend $1 million a year on my body, I probably would. Because imagine if the ease of someone doing it for you, it's just like having a chef, honestly. Like your nutrition will be so much easier if someone could just cook it for you, and all you had to do, if you told a chef, like, this is my goals, this is what I'm trying to eat, and they made it for you, and it just showed up, we would all look the way we want to look. Like
we'd be snatched.
100%. So it's that, look how important it is to have proper recovery, warm up, mobility. And do you see LeBron just walking on the treadmill before a game? No. They're out there like
he got bands,
putting up shots. They sometimes will even lift and stuff before on game days.
Which is it. So and I mean, a lot of athletes do that. I mean, Michael, that was part of his normal routine.
Yes.
Michael Jordan, the GOAT himself, did strength training workouts before his session.
Where you would think like, oh no, you want to save your energy. No,
it's in the science.
It was strategic. I'm sure he wasn't one rep maxing before a game.
And it's usually like light weights, but again, it's movement prep. You're prepping your body for the movement ahead. So
so those are just some examples, like just how important that recovery is. If you want to be 40 and still be considered a GOAT athlete, he wouldn't. I guarantee you, he wouldn't be.
That $1 million have made him $1 billion.
Yes.
That $1 million
he spends. Be, and every other great athlete who's playing longer than they should, I guarantee you that their recovery, their mobility, taking care of their body is a top priority. I guarantee it.
And I guess what we're trying to say is invest in yourself as best you can and as much as you can, right? Again, we all have social economic backgrounds that are different, but if you're going to invest in anything, honestly, your body is the most important. I think for me too, I hate paying for massages, but I feel the benefits of a massage. And if that saves me the pain that I experience over the course of a month, if that saves me the potential of getting injured, which will set me back, right? And then you got to think within our profession too, if we get injured, guess what? You can't have any workouts because we can't perform, right? So this is why we put a lot of energy and time and spend a lot of money on our bodies as well, because if we can't perform, we can't create content for all of you. So we realize, I mean, I learned that firsthand.
Our livelihood.
I learned that firsthand with snapping my Achilles, right? Like that was when I tore my Achilles, that was the first thing I thought about. I was like, we can't.
Don't worry. I still,
but luckily,
listen, and if I get hurt, he got the solos too.
I got the real MVP
thankfully,
over here.
we have
2 people. But imagine if I had this YouTube, imagine if it was just work out with Juice and then Juice got hurt.
Yeah.
I mean, granted, I will find a way to film some workouts for you all, but it's not going to be what everybody, the general population needs.
Yeah.
I'm going to be doing all upper body for 3 months until I get back on my feet. But
Crazy.
again, invest in yourself is important. It matters a lot more than you think. And you know, you can look, we've cut out certain things in areas in our lives so that we can invest in ourselves more. So sometimes it's just a priority thing too. And again, I always say this, give yourself the chance, give yourself a chance and the opportunity to feel the benefits of investing in yourself. LeBron, let's say he spent $1 million a year every year of his 20-year career. His 20 million, he's worth over $1 billion. So I think that's
a good investment.
I think that's worth the investment. So think about that for yourself. If you invest, let's say $100 in your body every single month, imagine how much time that buys you.
Yeah.
Imagine how much progress that buys you, right? So make that an important aspect of your life, and man, it'll change you for the good. So
yeah.
Lastly, a couple of things we've already mentioned one, but we want you to focus, you know, if you have knee pain, and a lot of times, again, knee pain comes from a lot of different things. Sometimes it's chronic. You might have arthritis, which is hard. You can't avoid that. Inflammation. It comes out of nowhere.
Flares, like
so
you could have.
Yeah.
There might be some days where I'm like, it's just a lupus flare. Like I know it's not tightness, it's not this, it's not that, and then I have to do things to decrease inflammation or whatever. But
it's out of your control.
Sometimes it is out of your control. It's not tightness. It's not something you're doing wrong.
You might be the most mobile,
Yep.
flexible, strongest person alive and still have knee pain from just autoimmune or a lot of different things that are out of your control.
Absolutely.
So this is where we do recommend low impact workouts, and I think they're becoming a lot more popular now because people are realizing like, oh wow, I don't have to do crazy Instagram workouts or
you don't
squat
have
jumps.
to jump off a wall to
Yeah,
lose
you don't have
body
to do all these special, spectacular exercises to reach your goals. You can reach your goals. Like I have clients, again, I mentioned before, we never left the ground, right? We've done, you know, the boring stuff and they've reached their goals. Don't feel like you have to do like all this spectacular stuff. So, excuse me, do more. This is why we've included a lot of more low impact workouts on our channel, but also, you know, even if we want to do higher impact workouts for people who are more advanced and more skilled, you know, we usually have Toya I do a modification for that exercise, just so you can feel like, again, you're still effective. I don't want people to think, oh, I'm not doing the squat jump. I'm not getting the most out of this workout. So implement more low impact workouts, but also if you're someone who experienced knee pain that could be potentially in your control, don't avoid certain exercises. You can still do low impact workouts while still implementing the things that you need to do to improve or take that knee pain away. So again, do those low impact workouts, but also do the things that you need to do, the stretching, the mobility, and then single out that strength work. Maybe if you struggle with lunges or if your quads are weak, just focus on your quads one day a week just to build that strength. And over time, you'll notice that pain would just get alleviated just by spending some time on it. So while you're doing that low impact stuff, also focus on the things that you need to do to essentially heal your knees.
And then last but not least, like you said, we mentioned this one too. If you're trying all of these things and nothing is working and your knee pain is chronic and you're still feeling the pain, check in with the doctor, because it could be something like arthritis or something that
or could be torn,
needs to be assessed and taken care of, or exactly, you could have a tear that something you're not going to fix on your own, that you might need surgery, or you might need like proper rehab specialists, like really helping you fix this. Again, way out of our line of work. And even sometimes a personal trainer you're seeing, like even if they have so much experience, it might be something that they don't know, you know, and that's okay. That is totally fine. So consult with the doctor, PT, movement specialist. There's so many different places now you can go for that. There's so many PT places that you can go to without having to go to your doctor now. So the help is out there. Get the proper help, especially if it's something that is chronic. And in that instance, I would also say don't consult with the internet. Don't get on the internet. Don't listen to an Instagram trainer. Don't listen to me. Don't listen
Google,
to YouTube.
Why do I have knee pain? It's going to tell you 5,000 different things.
If you're having some chronic pain, get it properly checked out, because you also don't want to make something worse when it could have been fixed more easily. and you just allowed it to get worse.
For sure. So
yeah.
Just to we're just going to recap everything that we mentioned. And the reason I want to recap it, because I want you to focus on these things first. And then again, if none of this works, and give yourself some time to, if you know you're weak or you're super tight, give yourself some time to focus on that first. And if you're still experiencing the pain, then go consult with your doctor. And the reason we say this too is because, and it's sad, and I'm just calling out the truth. A lot of times certain doctors don't have your best interest, and sometimes they're just looking for money, and they might just have you perform a procedure that you probably don't even need, that can be fixed with something else. Especially
so sometimes it's good to get a second opinion, because
100%.
I had a great doctor who was like, try these things first, and if that doesn't work, then great. But I've had family members or clients who did not have that same, where they're like, oh, if it hurts, let's just go ahead and do full replacement now. Like,
okay,
yeah, because you trust your doctor. So
they know more than you, so you just
agreed.
So just to recap, stretch. That's the first thing you need to start with. If you know you're tight, I guarantee you that's going to alleviate at least some pain. Do some stretching and mobility work. It makes a difference. And I'm speaking to myself more than anybody right now. So probably need to hit a stretch right after this podcast. Number 2, just doing exercises incorrectly. Focus on the form. And I want to highlight, we do have a video. You might not have known. You might have just joined us. We have a video on our channel. It's called Form Check. So just type in Juice Toya Form Check or go to our channel. You'll find it. We did a whole video on common exercises that people struggle with, and workout exercises that we do within our workouts that people struggle with form. And a lot of people learned so much from that video, just doing the form properly. So highly recommend you go check that out. Number 3, correcting imbalances. If you're overcompensating from right to left, if you have weaknesses that are different from right to left, that can cause imbalances, and that can be another source of that knee pain. Number 4, hire a personal trainer. I mean, we're not available right now, but if there's a personal trainer that you might have seen or can work with, just even if it's just for a couple of sessions, just have them look over some of those movements, and you might be able to find out something that's that's causing that knee pain with certain exercises that you're doing. Drop the weight. If you're finding that you have knee pain with certain exercises and you're using actual dumbbells or you're loading it, drop the weight, do it body weight, and focus on that first. And then as you sort of build confidence with that movement and do it correctly, you can start to load it, and you'll feel the benefits of loading something that you're doing properly. If you're overweight or even obese, that's going to be an easy way that you're adding some load to your skeleton, load to those joints. So honestly, losing body fat over time will help alleviate a lot of the pain that you're experiencing, and not just in the knees, in the shoulders, hips, everywhere pretty much. Warm up, cool down, very important. That all goes into the line of recovery and stretching. And last but not least, again, if none of this works, give it some time. Give yourself a couple of months or so to focus on all these things, and you still feel like I have some chronic pain. Again, it might be something out of your control, or you just need some extra guidance with a PT or doctor who can lead you in the right direction. It is much more important to go consult with a doctor than to just deal with this forever, because you don't want it to get worse. And I think a lot of people let it get to a point to where that's where they start to avoid certain things like lunges and squats. We don't want to do that. Those are all functional movements that you should be able to do no matter what your age is. So again, consult with your doctor. And if you can get something done or something, some information that'll help you put you in the right direction, it's more worth it to just fix the issue than try to avoid it for the rest of your life. So that's pretty much all. Did I miss anything? I think that's it.
That is it. That is it. That is recapped. So yeah, definitely take some of these points into consideration if you're someone who struggles with knee pain or struggles with some of those exercises. But that's it.
All right. So hopefully you learned a lot from this podcast today. Again, I've had 2 MCL meniscus surgeries, and I've learned so much about knees. I've been able to carry my experience as well as my knowledge that I've learned from going to school and having my CPT and experience that I've gotten from training to be able to just put these points together, because these are the common things that I see as a trainer that are pretty avoidable, and it honestly prevents a lot of people from going to the doctor because they can kind of focus on these key points. So please drop a comment if you found any of these things useful. Let us know in the comments of our YouTube channel, but also wherever you're listening to this podcast, let us know if this was helpful in any way, and we really appreciate the feedback. So if you We also want to make this into a video at some point
Yeah.
too. It's just hard to put in a video sometimes. But all right, that's pretty much covers it all. But you know what time it is.
Let's wrap up with the dad joke. I got one for you today.
What's up? Let's hit it.
What does a nosy pepper do?
What does a nosy pepper do?
Yes.
Nosy pepper, like a hot pepper or like a bell pepper.
Hot, bell, any of them. A good pepper.
Okay. I don't know.
Gets jalapeno business. Jalapeno business.
So
He gets jalapeno business.
that's so bad. Okay. I've heard
I got
that.
one more. I got one more.
Dang, she got two today. That's crazy.
What did the baby corn say to the mom corn?
Oh my God. What did the baby corn say to the mom corn?
Yeah.
Cob. I don't know.
Where's my popcorn?
My
Do you have one today?
popcorn. Yeah, I got one.
Okay, go ahead.
So the Super Bowl is coming up, and shout out to your Kansas City Chiefs. They're going to the Super
Shout
Bowl.
out to the Chiefs.
My Cowboys at home.
Should have
That's
worn my
all-
Chiefs shirt.
You should have.
today,
I was wondering why you
but
didn't.
No, Lakers won, and I just got this shirt. So
Yeah, she wanted to show off her shirt that I'm going to take. But I have. I think I'm gonna make it football related today. So,
Okay.
I always start off with an easy one. So here we go. Why did the football player ask for a refund? Why did the football player ask for a refund?
he wanted his quarterback.
Yeah, that's an easy one. That's an easy one. Yeah, you probably.
Shout out to Patrick Mahomes.
Shout out to Patrick.
All right.
I have another one. I wrote it down so I wouldn't mess it up. Last time I got booed by myself.
Yep.
What's a football player's favorite kind of ice cream? What's a football player or football lover's favorite type of ice cream? 5 seconds.
Offense or defense?
It don't matter. Football player. That's why I said that.
Okay. His favorite type of ice cream is, I don't know.
Any given Sunday. Because they play on Sundays. If you don't watch football, they play on Sunday.
And Mondays and Thursdays.
Yeah, but mostly you show up for Sunday. All right, I got
So
one more.
All right, last one. Let's wrap this
All right,
up.
what did the football player say to the flight attendant? What did the football player say to the flight attendant?
I don't know.
Put me in, coach. Put me in, coach. Put me in, coach.
I get it now.
Okay.
Okay.
Hey, give me
Okay.
drop in the comments
One for
how
three.
I did today. I know last week was a struggle, but I think I'm coming with it.
I like the football theme. I
thought you was gonna come with another egg joke today, man. I was like, I'm tired of these
Change the
eggs.
food.
Okay, she loves food, so we're probably hungry. I am hungry right now. So
Yes.
again,
We will wrap this up. I know this one went a little bit longer than we wanted, but
It's okay.
lots of great info. I'd rather kind of spread it out than
y'all
try to
let
force
us
it in.
y'all let us know too. If these podcasts too long? Do you want them shorter? Do you want them longer? We don't know. We're just talking over for an hour. We figure that's enough time to get some good information. So let us know. But anyways, we appreciate you for joining us for another podcast. Again, be sure to check out the Fresh Start Challenge if you haven't already. If you need some routine, you need to schedule. Fresh Start program is great. We had over 1,000 people do the program in one way, shape, or form. So go check that out, as well as we got the Level Up 2.0 challenge coming up in a couple of weeks. So be on the lookout for that. Be sure to join our mailing list on onebodyla.com. Put your email on the list so you don't miss out on the updates that we're sending out, so you're aware of what's going on. So with that being said, we appreciate all of you. I mean it. Be sure to drop a 5-star rating wherever you're listening to this podcast. We appreciate all the comments and the ratings, and we're trying to find ways to improve and give you more content over time. So we appreciate you for joining us.
Yes, thank you for joining us. As always, we appreciate all of your support, and we'll see you all at the next one.
Hey, welcome back. Let's get it. Back.